Hello, my name is Hernan Cortez, and today's event title is What Am I Taking? Every year we hear commercials of law firms stating, if you took this medication, you may be liable for compensation. I feel medications and prescriptions are important, but also education, knowledge, and alternative medicine before starting medication. I feel healthcare is crucial to help the well being of patients, but we must approach patients holistically. Before prescribing a medication and following the standard guidelines, a person's mental health, physical, and emotional health must be assessed along with a good rapport built. I think the healthcare system is limited to patients with their time spent with doctors and nurses. And lack of education is easier to just prescribe something instead of finding the root of the problem. Patients need choices and education on medication prescribed and teach alternative options for a full autonomy decision of medication. There's a pill for everything, including for both physical and mental diagnosis. Before we start patients on medication, we must find alternative to give a chance to try and fix a problem ourselves. Every human genetics is different, and a pill will not work the same for everyone depending on their lifestyle, race, socioeconomic status. Identifying the best pathway to personalized and population medicine involves the ability to analyze comprehensive patient information together with a broader aspect to monitor and distinguish between sick and healthy people. This will give us a better understanding of biological indicators that can signal shift health. As a healthcare provider, we aim to do good, but sometimes prescription medicine do more harm than good. The fact that we just labeled a diagnosis, we must also educate on that diagnosis and prescriptions and alternative for one to reverse the possible problem. Autonomy is clearly violated when not enough education is being provided about the diagnosis and the prescription side effect and risk. We should be fair with everyone and not just generalize a certain culture population based on previous patients of the same culture. There's a clearly conflict of interest. Did you know that doctors are monitored according to whether they prescribe medications? If I don't follow the cholesterol guidelines by prescribing statins, insurers will send letters scolding them. If I don't talk to you about cholesterol lowering effects of walnuts or oat bran, nobody cares. This is important to my profession. The future is in our hands of those patients. Obesity is increasing along with mental health, and we must understand why. Comparing healthy people 2020 and 2030, the obesity is getting worse, mental health is getting worse. We have obviously not fixed the problem in 10 years, so we should do a different approach. Instead of developing a new medication for anxiety or upping the dose on a depression medicine or a stronger cholesterol medication, let's find the root of the problem from the beginning. As a nurse, we have a duty to protect and advocate for a patient's well being and use our judgments to see if the patient will benefit or even have more harm from these medications. If the doctor wants to prescribe a statin, which is lowering cholesterol medicine that metabolizes in the liver, but the patient's already metformin, which also metabolizes in the liver, and the patient is a social drinker, that the doctor didn't know that. So now we have multiple things being metabolized in the liver. This could potentially make things matters worse. More education, funding, and sooner appointments and accountability between patients and doctors is one of the issues healthcare needs to implement. Transitioning programs instead of checking hemoglobin every 3 months to see how much to increase the metformin. Set a realistic diet and exercise to prevent metformin being prescribed at all. And we must put our part too. We hold patients accountable as well. That way, autonomy was given to the patient to change habits before starting them on prescription drugs. As I mentioned before, we must execute the root of the problem. A medical encounter that generates a prescription is considered more complex, which qualifies for a higher reimbursement. In contrast, if a physician uses some of this very limited time with patients to talk about antioxidants, omega-3s, fatty acids, they get nothing more. That's why, unfortunately, pharma rules. Even though there are literature full of data about health benefits of various foods, foods do not have a dosing data. And that's why it is important for us to attack this problem, especially now going into Healthy People 2030. What's causing the obesity to go up? It's not time to develop a new medicine that reduces fat. Let's figure out alternative ways, holistic ways. Why FDA approves certain meds but not others? Why antidepressants take a month to work, and once they reach therapeutic level, patient feels worse. And other patients get ketamine infusions for 1 hour and never have to take medicine again. Or why is it that we don't talk about marketing on obesity, regulating certain sugars, using cartoons as luring kids into the market for unhealthy choices, doing a windshield surveys on these communities and finding out the real problem, instead of just setting a website that talks about our plans for 2030, 2040, 2050, when we clearly seeing that the problem keeps getting worse and worse and worse. Thank you.